Well, hey everybody, this is Robert and welcome to today's show. Now, a lot of news going on in the world of COVID vaccines, and I want to go ahead and take a look at what's going on as of today, December 1st. And back in November 20th, Pfizer and BioNTech went ahead and submitted their Emergency Use Authorization to the FDA for their COVID-19 vaccine. And this vaccine really made the news big. It was very successful. They said they had an efficacy rate of 95% and no serious safety concerns observed to date. So what we know about this so far is the FDA is expected to meet on December 10th to make the decision about giving it the EUA, and the day after it's going to start flying off to the different places for use. So very exciting news there. Another vaccine is Moderna, and this one had a lot of success also. And this was about 10 days after the Pfizer announcement, and Moderna announced primary efficacy analysis of, I think that was 94%. It was very high also. I mean, these are numbers that you almost see with the measles vaccine. That's how successful it is. So the Moderna vaccine had an efficacy rate of about 94.1%. And against severe COVID-19, it was 100%. So very, very effective vaccine. It was generally well tolerated, no serious safety concerns. And Moderna announced they were going to be applying for an emergency use authorization with the FDA. And we'll see what happens there. It seems like that'll probably be about a week after the decision for the Pfizer one. So look at it for around December 17th. So we'll be keeping an eye on that news. And then there's other, Johnson & Johnson and other companies are moving pretty rapidly too. So we're going to start seeing a lot of this stuff coming through the pipeline. Well, the big news today was the CDC ACIP panel, the ACIP panel. I think that's called the Committee for Immunization Practices. And they met today for a couple hours from like 3 till after 5 or 2 till after 5. It was quite a long meeting. And they came up with some recommendations for the CDC. And this is from The Hill. They were the first ones to report on it that I could find. And it says health workers and residents of long-term care facilities should be at the front of the line to receive the first limited doses of COVID-19 vaccine, the Federal Advisory Panel formally recommended Tuesday. The specific recommendations from the Centers for Disease Control and Prevention's Independent Advisory Committee on Immunization Practices, or ACIP, were expected. The vote came out as 13-1 passage for the recommendation. The recommendations for the Phase 1A will be sent to CDC Director Robert Redfield, and if he approves it, it will become official guidance from the CDC. Now, they say states don't necessarily have to follow these recommendations, but it gives them much needed guidance when it comes time. Now, it says once the recommendations are adopted, it will mean other high priority groups like people older than 65, essential workers, and those with underlying medical conditions will have to wait for the second phase, which ACIP has classified as 1B or later. ACIP is planning on discussing those groups later in the month. And they have some other important information here about how long it's going to really be. It says federal health officials said they expect to have enough doses of a shot from Pfizer and another from Moderna to vaccinate 20 million people by the end of the year, a fraction of the country's 330 million people. And you have to remember that each vaccine is a series, a two-shot series that is administered 1 month apart. So they produce 40 million vaccines. 20 million people can get vaccinated. So anyway, that's that's the news that came out of Atlanta today at the CDC. And then just want to show you the vaccine distribution process from Operation Warp Speed. And I want to go down to, we passed all this, and we go to the FDA portion, all right? Based on data from clinical trials, vaccine candidate is submitted for an EUA, Emergency Use Authorization, and it'll be reviewed, the application will be reviewed, and hopefully approved. Next, what would happen is it goes to manufacturer, but these vaccines have been being manufactured concurrently with the clinical trials. So as soon as CDC says it's good to go, or the FDA says it's good to go, it's ready to ship. And that's what they've been saying. It's going to ship the day after. And this is, if you look here on the right-hand side, this is where we are now concerning the allocation of the initial limited doses based on CDC prioritization models. And we already saw that. It's going to go to frontline healthcare workers and people in nursing homes and the like. So that's going to be the priority initially. And we aren't here yet. And the next phase would be distribution, administration, and long-term pharmacovigilance, which is where they're going to be monitoring for adverse events over a period of years to see how the vaccine took. So that's what's happening, and it's following pretty much the plan of Operation Warp Speed. This American Medical Association put this out today. It's a letter to the public. And it says, since the beginning of the COVID-19 pandemic, we have come together as physicians, nurses, hospital and health system leaders to urge the American people to protect themselves, their neighbors, and their loved ones amidst the worst global health crisis in generations. As we approach the point when a vaccine may be available, more than 260,000 Americans and more than 1.4 million people worldwide have lost their lives to COVID-19. We know that the vaccines will help save lives and help us turn the page on this virus. Vaccines have eradicated smallpox, has nearly eliminated chickenpox and polio, and minimized the impact of countless other diseases. To achieve a similar result from COVID-19 vaccines requires trust in the process to develop, distribute, and administer a safe and effective vaccine, and a broad willingness to get vaccinated. So they're just saying, they're encouraging the public, to go ahead and really consider getting this vaccine. Really consider it. And they also want you to continue doing the other steps, the physical distancing and washing your hands and the face mask and all that. But again, this is a message from the AMA to the public concerning the COVID vaccine. So they are encouraging the public to trust the process, because in order to achieve what it can achieve, there's going to have to be a good percentage of the public actually get the vaccine series so we can achieve some sort of herd immunity from the vaccine. All right. Next. That's always the problem. And that was always my question is like, gosh, you can't get that many people to get the flu vaccine every year. How are we going to get people to do the COVID-19 vaccine? And this was one of the more recent polls I could find. This is from November 10th. And this is a Stat News Harris poll. And it says most Americans won't get a COVID-19 vaccine unless it cuts the risk by half. And it says 6 in 10 Americans said they are somewhat or very likely to get a COVID-19 vaccine, if doing so would lower the risk of becoming infected by about half, according to the new survey. The poll also found that more Americans say they are likely to get a vaccine, practice social distancing, and wear a mask if they or someone they know has contracted COVID-19. The poll, which surveyed about 2,000 adults toward the end of October, suggests that even a less effective vaccine than what we are seeing now, the Pfizer and the Moderna ones, wouldn't have a outsized impact on the public's willingness to be immunized. Among those queried, nearly 2/3 reported they would get a vaccine if the shot lowered their risk by contracting the coronavirus by 75%. And this is a quote from the director of the Harris poll, and he says, quote, "If we're actually at 90%, it's going to reinforce for 2/3 of Americans who are then much more likely to take the vaccine. Although I think it's fair to say that it doesn't need to be 90% effective to get that pull through." He continues, "It may not be necessary to be at 90% that Pfizer is showing in its preliminary results, but the data indicates it will have to be over 50% for the general public and over 75% for that of the younger generation of Americans." So that's a little bit more promising than I've seen in previous polls. So that's some good news. And this is the most recent poll I could find, and it's on one state, and that's from Massachusetts. And this actually came out today, and it was a poll by Western New England University. And it says, survey finds that more than 1/3 of adults would be unlikely to seek the vaccine. Nearly 60% of adults said they would be very likely or somewhat likely to get a vaccine to prevent COVID-19 if the vaccine were available today, according to their latest survey. And the survey was of only 415 adults during the past month, about the end of October through the end of November. And it found that 36% of adults said they would be very likely to get the vaccine, while 23% they were somewhat likely. So again, it could be worse. These numbers aren't nearly as bad as some of the earlier surveys, which were somewhat lower. And the last thing I want to touch on is this report out of Cancer Health. And there's some documentation that shows that COVID-19 has affected minority communities, in particular the African American or Black communities, harder health-wise than it has, other racial groups. So in this report, it says Black doctors urge African Americans to take future COVID vaccine. A group of medical decision makers assume responsibility for protecting the health of those in the Black community. And it says, as more research is emerging about the effectiveness of COVID-19 vaccines in development, a prominent group of Black doctors is encouraging Black Americans to take the vaccine when it becomes available. Quote, "We ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective," the doctors wrote in an open letter. "We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival," closed quote. It says, despite being disproportionately impacted by COVID-19, an August poll by Axios Ipsos found that 50% of Black people were unlikely to get vaccinated. Furthermore, 72% of Black respondents said they wouldn't take a first-generation COVID-19 vaccine once it was available. Some of that goes back to a lot of mistrust and skepticism over previous unethical research, like the Tuskegee syphilis study. We all know about that. And they, in this article, they even point to the Henrietta Lacks situation. And if you're not familiar with that, that was a Black woman who had cancer, and her cells were taken for experimentation without her knowledge as the cancer progressed. So this group of doctors, which is essentially National Medical Association, the National Black Nurses Associations, Howard University, and the Black Coalition Against COVID, stressed that Black bodies and lives must be a core value for those working to find a vaccine for COVID-19. So yeah, they're encouraging a population, the African American population, that has been hit very hard by COVID-19 these past 8 or 9 months. So yeah, so they want Black people to trust and get the COVID vaccine when it becomes available. And that's the news I have for today concerning the COVID-19 vaccine, the progress, the EUAs, what happened today in Atlanta at the CDC, and some other polls and some other information. So I hope you enjoyed the show, and I'll see you next time.